Hi, I'm Dan Major, and I'm here for Life the Basic Manual. And we're continuing to talk about recovery from addiction and chronic pain as co-occurring disorders. And as I mentioned in our last segment, because addiction and chronic pain have significant mental, emotional, physical, and spiritual elements, recovery from them has to include work in each of those four extremely important life areas. And in last segment, I talked specifically about working with our thoughts and our thought process and the importance of becoming consciously aware of our thoughts and how we think. And that gives us separation from our thoughts and our thought process, so we can look at them, we can evaluate them, question, or dispute them, and make a conscious decision about how much attention to pay to them. And we also talked about the relationship between thoughts and emotions, and that often our emotions flow from the quality of our thinking, that before there's a feeling, there's often a thought. Now, as it relates to emotions, one of the things that's especially important pertaining to addiction and chronic pain is the distinction or lack thereof between physical pain and emotional pain. You know, over the course of the last 30 years, a tremendous amount of scientific research has demonstrated the profound and direct link between the mind and the body, and that whatever affects the mind affects the body in very substantial ways, and vice versa. So for people with chronic pain, the way it works is that when we have physical pain, and this is true for anyone, whether they have chronic pain or not, in fact, if there is physical pain, whether it's related to an injury or an illness, we have a nasty cold or a flu, how does that affect us emotionally? We tend to be irritable and anxious, and we have low energy, and we feel fatigued, and we may want to isolate and not want to be around people. We're generally incredibly uncomfortable and miserable emotionally as well as physically. With chronic pain, the more physical pain we experience, as I mentioned in the last segment, the more likely we are to have feelings that relate to irritability, frustration, anger, sadness, depression, anxiety, fear, and so forth. One of the most important things we can do related to working with our feelings as part of the recovery process from addiction and chronic pain is to be consciously aware of what those feelings are. Quite often, we're experiencing some level of pain, whether it's physical and or emotional, and it really doesn't matter because they transfer from one to the other and activate each other continuously. But often, the pain and discomfort exists beneath the level of our conscious awareness. We just know that we're miserable, that we're uncomfortable, but we don't necessarily identify what specifically it is. And so, in response to pain and discomfort, one of the things that tends to happen is because we don't want to be in pain. Who wants to experience pain or discomfort? So the natural human tendency is to seek ways to avoid it. And obviously, using mind and mood altering substances is, at least to begin with, a very effective way to avoid pain and discomfort. Using pain meds in the case of chronic pain, opioid pain medications specifically, is a way of avoiding feeling discomfort or pain. The problem is all of those substances wear off. And the longer we use them, the more quickly they wear off. And when they wear off, we find ourselves in even more discomfort because of the pain of the immediate withdrawal. There's micro withdrawal as soon as the medication itself starts wearing off. And then if we're used to that medication, if we are addicted to it, if we're physically dependent upon it, when the supply runs out, there is more sustained macro withdrawal, if you will. So in our next segment, I will speak more specifically to conscious awareness of and working with our emotions as a way to facilitate the recovery process.